Welcome to another seminar. We're going to talk about the shoulder today and some issues that may come about, pain, dysfunction, and some review of anatomy. So let's get started. So the shoulder. The first thing that we want to do when talking about the shoulder is to dive into some anatomy. So here's a quick video that we're going to take a look at that talks about the rotator cuff and the muscles associated with the rotator cuff and which ones they are, what do they do, how do they play a part in the shoulder itself. Here's a good view of the rotator cuff from the back. So we have one coming through here, right? So this is the top, this is the bottom of it. So this is the infraspinatus, supraspinatus. Then we have the teres, and then the other view, the subscap. So there are four muscles, and you can see that their attachment kind of covers the humeral head. They have different functions, but ultimately they're there for stability and some movement to clear some of the bones when you lift your arm in certain directions. So we'll talk a little bit more about those later. But another important muscle group are kind of the bigger muscles that are overlying the rotator cuff. So the trapezius, which is here, the trapezius is broken down into three parts. So we have the upper trapezius, the middle trapezius, and then the lower trapezius. We also have the lats. Typically, you don't think of the lats as a shoulder muscle, but it does go all the way up and it attaches to the arm. Then we have the rhomboids. So they go from the shoulder blade and they come up and attach to the spine. And then the levator, which is also from the top of the shoulder blade from that angle, and then goes up and attaches at the neck. So those are kind of big important muscles that we need to talk about as well. So why is the shoulder important? Why are we talking about it? Well, the shoulder itself, as the video talked about a little bit, is not stable, right? So imagine you have a tee and then you have a ball, right? A golf ball on top. Inherently, that ball, the size of that ball compared to that tee is not proportional, right? So that ball is inherently unstable on the tee. And that's kind of what a shoulder joint is. Now, if you have instability, you need to find a way to counterbalance that. And the way that the shoulder does it is through muscles that encompass that joint, that provides the stability. So the shoulder functions through a series of actions from different muscle groups and from different joints. The first one we talked about was the rotator cuff. The rotator cuff inherently provides the stability and also the movement. It helps to start movement. It helps to prevent the shoulder from getting stuck in a position. There's certain bones, certain projections on the humerus that need to clear this space right here underneath the clavicle. So when you have that movement, you need to clear that space to get the full range of motion. Then we have the scapular muscles, the scapular stabilizers, which we'll talk about. I showed you that picture with the trapezius, the rhomboids. Those are two big components of that. And then the thoracic spine. We talk about the thoracic spine. It's kind of a separate entity, but in order to get full range of motion, you also need to have some extension to your thoracic spine. And the importance of talking about this is you want to prevent injuries, right? So the shoulder being inherently unstable, it sets you up to suffer injuries. So we want to make sure that we talk about ways of avoiding that and how to strengthen the areas around it. The big thing, and probably the most important thing to talk about, is posture. Now, posture we can talk about in terms of the neck, the back, hips, any joint in the body is affected by posture. But the shoulder itself, we call certain dysfunction upper cross syndrome. We see that commonly. I'd say it's one of the most common presentations that we see, especially from those of us that work on computers. We sit for a long time. We have more sedentary jobs. We will see the upper cross syndrome present itself. And what the upper cross syndrome is that it's a series of weak and tight muscles that follow a path such as this. So we have a model here with the forward head position, right? So the chin kind of projecting forward, shoulders are kind of rounded, more of a slouchy position. And so the presentation we commonly see is we have a weakness in the front of the neck because of that forward head position. You're lengthening those muscles. And then we have weakness in the rhomboids in the lower trapezius, middle trapezius, and that's where the shoulder stabilizers are. So if you're rounded forward and your shoulders are forward, you're again lengthening the muscles that are attached here and making them weaker. So we have the weakness that follows this cross pattern, and then we also have tightness. So if you're rounded, the front gets tight. So that's where we get the tight pecs. And then in the back, in the neck, we get the tight upper trapezius, the levator, and then the suboccipitals. So muscle groups that are up and back. So in this image, this little area here at the base of the skull, that's where our suboccipitals are found. Now, the important thing with the suboccipitals is that sometimes when you have headaches that kind of originate and they come up on one side or both sides, sometimes they can be a result of tension in these muscles. So if they get shortened, so they get tighter, there are nerves that travel out of here that can get impinged, causing headaches. So if our posture, or if we're sitting for a long time with our head forward, those muscles can get shortened, they can get spasm, and they can cause headaches. So we want to make sure we don't have those get super tight. So that's posture. Now, which muscles do we target when we talk about the shoulder? The first group is the rotator cuff. So here, there's a really cool kind of kinesiology diagram talking about the movement that needs to happen when you lift your arm up overhead. So in order for the arm to move, the ball, right, in its socket needs to roll up. So it needs to do an upward roll and also a downward glide. So it needs to that needs to happen for it to clear this small space here. So this bone needs to basically do that motion in order for the arm to go up. So in order for that to happen, we need muscles to help guide that movement. So we have the deltoid, right, the big muscle on the side here that helps us to lift that arm up. We have the supraspinatus that helps to initiate that glide, right, that roll and the glide. And then the other rotator cuff muscles, so the subscap, infraspinatus, teres minor, help to pull the humeral head down to prevent it from getting stuck underneath here. Okay, so the supraspinatus is our spacer. So this small space here is being occupied by that supraspinatus. It helps to initiate the movement, so it helps to start it off. Once it starts, you have this bigger muscle, the deltoid, that can help finish it. Then you have the infraspinatus, which helps to glide the humeral head down and to help clear some of the bones so they don't get stuck. And same thing with the teres minor and the subscapularis. Those are the four muscles of the rotator cuff and what they do. They're very important. They serve very prominent roles in making sure that our arm does what it's supposed to do. Now, the other ones are the scapular stabilizers. So these are kind of adjunct to the rotator cuff. So they help the rotator cuff out. We have the trapezius muscles, the serratus, the levator, and the rhomboids. So in order for that arm to go up, the shoulder blade needs to be stable and help it along, right? So this shoulder blade here, the scapula, needs to rotate up to help the arm go up as well. So it's a two-part process. So you have muscles that help it rotate. So for example, the trapezius muscle helps to rotate it. The serratus muscle, which you can kind of see right here, helps keep the bone, the shoulder blade, flat against the thoracic, the ribs. So you have the flat positioning and then the rotation. So the serratus isn't functioning, it's kind of wobbly. Think of it as like a boat tied to a dock, right? So if that dock isn't stable, you don't have the stability in the boat and it can't be fixed, right? So you want a stable dock to allow everything else to function. The levator is another muscle. It's kind of right here. It's attaching at this angle at the top and coming up. The rhomboids are right back here. They kind of, again, help anchor the shoulder blade against the spine. And we'll talk about kind of the breakdown of the trapezius a little bit because they do function a little bit differently. So let's go into 4 categories of shoulder injuries, what we might commonly see. Number 1 are tendon inflammation or muscle injuries, and that's probably the most common that I see. We're talking about strains, tendinitis, bursitis, which is the inflammation of this bursa, right? A sac that kind of helps keep everything fluid and gliding properly, right? So it's kind of right here where the tendon is, giving some separation between the tendon and the bone. We can have tears, rotator cuff tears, or we can have impingement. Now, impingement is something that gets thrown out, right? But not a lot of times explained. So what impingement is as we talked about earlier, that supraspinatus tendon goes through this little space here, right? That space is pretty narrow. There's not much wiggle room there. So when we have a condition that narrows that space, it can impact that tendon, causing inflammation, pain, and difficulty in moving the arm. So if you ever have a pinch, right, you're lifting your arm and you feel that pinch in your shoulder, that can be what that is. So our goal as physical therapists is to provide relief to the tendon, right? We're gonna do everything we can to make sure that space is open for the tendon to do its job. So when we have posture that's closed off, that space gets narrower, and then you're more likely to have impingement. So it's really important to address the why. So why is this happening? Is it posture? Is it weakness? Is there something else? Is it a bony issue, right? So some people have different shapes of their bone, right? In this area here, they could be more curved. It could be more straight. It could be flat. So we can see that on x-rays. We can see how the bone is functioning. Is it decreasing the space? You know, things that we need to know. Or we can go in and see, is the weakness or the posture causing that space to get narrower? So another one is instability. When we talk about instability, we talk about dislocations, subluxations. So that's basically the humerus, the humeral head, either subluxing, kind of coming out of that joint, or completely dislocating, right? So that's a whole separate issue. You can have fractures associated with that. You can have chronic instability where that joint is now really loose. And in order to fix that, we have to strengthen the stuff around it, right? Like we talked about earlier, the shoulder joint's inherently unstable. So now if you have an injury that dislocates it, you add on to that instability. So you have to use the muscles to give it more of the stability. Then we have arthritis, OA, osteoarthritis, which can commonly happen as we age. We can have arthritic changes on the surface from overuse, from using it for too much, for doing repetitive tasks, and fractures are number 4. So more traumatic injuries to the shoulder, fractures of the humeral head. You can do, there's many different types of fractures. That's most commonly caused by a traumatic injury. Sometimes falling on an outstretched hand. So when you fall, you brace yourself with your hand and you might have a fracture. So just some examples of muscles to target, exercises that we do and why we do them. It may look odd when you're just looking at the exercise, but there's a rationale for all of them. So here, laying down on the stomach and being able to lift up and engage the shoulders is an important exercise to kind of counter our closed off position, right? So here you're actually extending, right? We talked about thoracic spine, you get a little bit of extension there. You get the shoulders, the shoulder blades coming together. So you're activating the rhomboids, the middle trapezius, the lower trapezius, and you're able to increase endurance for longer holds. They're kind of counterbalancing what's going on outside of exercise, which is more of a closed off position. Now, if you have a Swiss ball or a yoga ball, you can also do this similar exercise. They're called T's and Y's. So you don't need weight, you can use your arms. You're trying to do a T shape and bring your arms back to stimulate the middle trapezius. And then if you want to stimulate the lower trapezius, you do more of a Y pattern, the Y shape. So these are just common exercises we do to get those muscles to re-engage and to help. So another one here, this is kind of the same thing where you're trying to engage those shoulder stabilizers and work on posture, work on extension of the shoulders, thoracic extension, and even the chin tuck, right? So tucking your chin in helps to activate those weakened anterior muscles of the neck. And then foam rolling, super important. Just finding some time throughout the day to break up the task of sitting and being able to just lay down on the roller with your hands out to the side helps to loosen up the pecs. So those tight front muscle groups is really important. You have to be able to hold your position for a little bit and allow the stretching to occur in the front of the chest. So as far as exercises, just an example, those are some few common exercises that we give. So in this video, it's going to show what it looks like to have not a very stable shoulder. So there's going to be contrast between the right and the left, and see if you can identify which one that is. Which one's the shoulder that has more of the instability or the weakness and more prone to having an injury. So let's take a look. So this is a quick test where you brace yourself with one arm as you're falling against the wall, and you're able to kind of brace, and the goal is to stabilize your body. So here is the left side. So falling onto your arm against the wall and seeing how the shoulder reacts to that weight. That was the left. And then the right side, falling down, bracing yourself for impact, and then that's the right side. So, kind of in your mind, think about which side's the one that's affected. Which one would you say this person would be prone to injuring and why, right? So, here's the left again, and I'll show you. So, upon impact, right there. So, right, so you have the force through the arm, and we're seeing that shadow right here build up on the left shoulder blade. That's where we're seeing that shoulder blade pop up off of the ribs, telling me that there's some weakness going on and it's not stabilizing properly. So that's what I would be looking at. But then again, here it is. The shoulder blade's kind of floppy. And then when she pushes back up, you can see again, there's a little bit of that winging, call it winging. And then on the right side, it actually looks pretty good. So on the right, okay, so right here, so you see the shoulder blade, and it's not moving too much, right? So it's being stabilized by the muscles that we talked about. The scapular stabilizers are doing their job. So I would, assume if this person came to me without telling me anything, that the left side would be the one affected. And it turns out that yes, the left side is the one that hurts, and it's more of a upper trapezius issue with a little bit of impingement as well. So those are things that we look at, and that's why it's important to look at the shoulder blade when we talk about the shoulder. So I wanted to throw in a little preview of ergonomics and what that means. Why is it important? How does it affect your shoulder, right? Because you think of ergonomics, a lot of people think of neck, back, which is true, but the shoulder does play a huge part in that as well. So if you look at the standards, right, so the Occupational Safety and Health Administration, OSHA, they talk about what is ergonomics and why is it important. So ergonomics is just basically fitting a job to the person. So you have a job and you have to fit that to the person and make it as easy as possible on the body. So here, most of us that work with computers, there are certain positions that we need to attain in order to decrease the amount of stress on our body. So ideally, you want your head in line with the computer screen. You want the back supported, right? You want to be sitting all the way back and that the chair isn't really hitting the back of your legs, right? So you have some room here. You want to make sure your feet are flat. You don't want it to be just dangling. And you want your shoulders back. Elbows are supported, right? And you see how if you draw a line down, right? So here are her ears, shoulders down to the elbow and the hip. It makes a nice straight line, right? So if she was sitting more hunched, that line would be out here. So why is that important? Well, ergonomics is a way to decrease fatigue of the muscles. It can increase productivity. If you're in less pain, you can do better work, you can work longer, and ultimately reduce the number of work-related musculoskeletal disorders. So the strains, the tendinitis, the impingement, all can come about because our postures tend to get more rounded, we get more tired. We may not notice it in the beginning, but as we continue to do these postures, as the day goes on, you can feel tension build up in your neck, pain build up, and all of that is important to counter. So, in conclusion, right, we talked about the rotator cuff and the scapular stabilizers, and just like the minions here, you can't have one person changing out the light bulb. You need a group, right? You need a team. So you have the stabilizers, right? So you have these guys kind of giving the stability, and then you have this guy up here doing the light bulb. So in order to move our arm up, you need the stabilizers to function, and you also need the movers to function. So we look at those and we want to strengthen those. You want to give support to them. So big key thing is muscles can't perform the way they're supposed to if there's restrictions somewhere, right? So it could be joints or other muscle groups. So if we find tightness, we need to stretch it, right? Because the tightness does not allow for our posture to be optimal, which doesn't allow muscles to function the way they're supposed to. So this is where it's important to really address what are your tight muscles, where are your weak muscles, and let's counterbalance that. So what are the goals? Why do we make everyone exercise? It's easy to, get a massage, do a little bit of that, but why are we so big on promoting exercise? Well, again, we need to strengthen the muscles that have been inhibited, right? You want to stretch the muscles that don't prevent proper movement. So what we do is we look at the fundamental movement patterns. So pushing, pulling, pressing, lifting, things that you commonly do throughout the day. And we try to build exercises to look like these movements because these movements are complex activities that a lot of muscles have to work together on. So we can use that for endurance. So if you're sitting for 4 or 5 hours, you want to build your endurance up because we want to make sure that you can maintain your posture for that amount of time. So we use exercises to help promote that. So you see commonly we do a lot of these for big, complex movements. So that's pretty much it for the seminar. I'm going to post this on the website so you guys can look and review if you need to. Going back here to the ergonomics, this is just a little preview of ergonomics, but we will have an entire seminar for ergonomics that talks a little bit about what is the correct position, resources that you can use to kind of assess yourself, and different exercises, and a little bit of more of the stability stuff with that. So any questions, you could always email us, and we will have this on the website either today or possibly Monday. So that's it. Thank you for joining me. And that's the shoulder. We're going to have, again, the ergonomics coming up, some other exercise topics, and then maybe chronic pain. So thank you for joining me. I'll see you next time.